So here we will discuss about hypertension. So as you know, hypertension, commonly known as high blood pressure, is a chronic medical condition where the blood pressure in the arteries is elevated. It is a major risk factor for cardiovascular diseases including heart attack, stroke and heart failure. Managing hypertension involves a combination of lifestyle changes, medications and regular monitoring. Because as the causes of hypertension is more, so the type of treatment is also more. So, diagnosis and monitoring, the normal blood pressure range is 120 by 80. Actually, the systolic blood pressure up to 129 is considered as normal. If it is from 130 to 139 and diastolic pressure is from 80 to 89, then it is known as hypertension stage 1. And if the systolic blood pressure is more than 140 and the diastolic blood pressure is more than 90, then it is known as hypertension stage 2. So you have to do home monitoring if you are chronic hypertensive patient. So lifestyle modifications are diet. So dash diet is advised for the hypertensive patients or newly diagnosed hypertensive patients. So it emphasizes fruits, vegetables, whole grains and low fat dairy products while reducing sodium, red meat and sugar sweetened beverages. So reduced sodium intake causes, as you know, increased sodium in the body increases the water retention also. So increased water retention causes fluid overload and thus increases the blood pressure. Increased potassium intake also helps in controlling hypertension. So foods rich in potassium like bananas, spinach, oranges help to counteract the effect on blood pressure. So physical activity, we have to do at least 150 minutes per week of brisk walking or any other aerobic exercises, which helps to lower the blood pressure and improve the heart health also. Weight management, so maintaining a healthy weight or BMI is very much important. If you are maintaining a controlled weight or BMI, so the amount of fat in the body is less, as well as in the blood vessels also it is less, so it significantly reduces the blood pressure. You have to limit alcohol intake, reduced alcohol consumption to no more than one drink per day or one pack per day for women and two drinks per day for men. You have to quit smoking while managing hypertension because smoking significantly increases the blood pressure. So medications, first line medications are thiazide diuretics, ACE inhibitors, angiotensin 2 receptors blocker, calcium channel blockers, and beta blockers. So combination therapy, when the hypertension is not controlled by a single drug, then a physician can give you combination of two or more medications to control the hypertension. Regular follow-up is needed as once it is controlled or it the blood pressure is decreasing on and off, so we have to decide whether to continue the therapy or whether to regularly follow up. So there are so many factors which causes increased blood pressure. So we will discuss the factors and how to manage it. So contributing factors, stress comes the first among all the contributing factors. So chronic stress can cause elevated blood pressure. So stress reducing techniques are like meditation, deep breathing exercises, yoga, concentration, etc. Controlling blood sugar in patients with diabetes, managing blood sugar level is crucial as hypertension and diabetes often occur together. So they can increase the risk of cardiovascular events manifold. Managing cholesterol levels, so high cholesterol levels causes deposition of cholesterol in the blood vessels, which further disturbs the elasticity of blood vessels. So managing cholesterol through diet, exercise and medications is very much important to control hypertension. Apart from them, we have to educate the patient and support the patient. Patient education is very much important because so many people think that hypertension is uh, completely preventable. So it is not like that. You have to control hypertension and it is not like that that you will get rid of hypertension after taking medicines for 10 days or 20 days or 2 months. So you have to educate the patients that which factor is contributing to his or her hypertension, and support groups are there also. So special considerations is done for the elderly patients and pregnant women. Regular monitoring and adjustment is very much important for the hypertensive patients. You can ask the patient to come frequently to your clinic, or you can ask the patient to monitor himself or herself and send the screenshot to your physician. So emergency management, hypertensive crisis. If the blood pressure is more than 180 and diastolic blood pressure is more than 120, then it comes under hypertensive crisis. So it requires immediate medical attention. The situation can lead to severe complications like stroke and heart attack. So by adopting a comprehensive approach to managing hypertension, patient can significantly reduce their risk of complications and lead a healthier life. So the causes of hypertension is not merely cardiogenic. There are so many other causes for hypertension, and a physician must diagnose what is the cause for your hypertension, and he should treat them. So non-cardiogenic causes apart from cardiogenic causes are renal causes. In case of chronic kidney diseases, impaired kidney function can lead to fluid retention, because the main function is to remove the blood, to remove the sodium or excessive any other serum electrolytes or harmful substances out from the body. So in case a patient is suffering from chronic kidney disease, so the kidney is not able to remove the excess amount of fluid, which leads to fluid overload and thus hypertension. If the patient is suffering from renal artery stenosis, so narrowing of the arteries that supplies the kidney, so this will cause reduced blood flow to the kidney and thus reduce the kidney functions. So if the pressure is not maintained or proper blood is not going to the kidneys, so kidney will not be able to manage or excrete extra amount of fluid or extra amount of sodium or any other substances which are harmful to the body. In case of polycystic kidney disease, which is often genetic predilection, which can lead to hypertension due to impaired kidney function. The endocrine causes of hypertension are primary aldosteronism, which is also known as Cohen's syndrome. In this condition, there is overproduction of aldosterone. This is a hormone that regulates sodium and potassium balance. So it increases the sodium concentration. So because of that, sodium retention is there and thus water retention is there, which causes increased fluid overload and thus increased blood pressure. In case of Cushing syndrome, there is excessive production of cortisol, a hormone that increases blood pressure by promoting sodium retention and increasing blood volume. In case of pheochromocytoma, this is a rare tumor of adrenal glands. So as it is a tumor, so adrenal gland produces catecholamines, and if it becomes cancerous, so more cells are there, so excess catecholamines are there. Example is adrenaline, which further leads to severe hypertension. In case of thyroid disorder, both hyperthyroidism and hypothyroidism can cause hypertension. In case of hyperthyroidism, which means increased thyroid hormones, that is increased T3 and T4. So the thyroid hormone regulates the basal metabolic rate of our body. So BMR is increased significantly, heart rate is increased significantly, and thus cardiac output is also increased significantly, which further leads to hypertension. While in case of hypothyroidism, the BMR is decreased, but water retention is there, and also it causes peripheral vascular resistance. So because of this factor, the patient becomes hypertensive. In acromegaly patients, excessive growth hormone production is there due to pituitary tumor, which can cause hypertension through increased sodium retention and changes in the vascular tone as it causes vasoconstriction. Vascular causes of hypertension are aortic coarctation and vasculitis. In case of coarctation of aorta, which is congenital narrowing of aorta, the main artery leaving the heart, this is the main and the biggest artery, because of its coarctation, coarctation means narrowing. So because of narrowing, the blood pressure of the upper side of the body is increases. Because from the arch of aorta, the main arteries which supplies the upper part of the body including head and both upper arms, the branches come out. After that, it continues as descending aorta, which further supplies abdomen, thorax, and lower limbs. If the patient is of vasculitis patient, so here inflammation of blood vessels is there, so which causes narrowing and blockage, which further increases the vascular resistance and thus blood pressure. Lifestyle and environmental factors for hypertension are obesity, excessive body fat, particularly around the abdomen, can lead to increased blood pressure through several mechanisms, including insulin resistance, increased sympathetic nervous system activity, and inflammation. Excessive alcohol consumption, chronic heavy drinking can raise blood pressure by increasing the sympathetic nervous system activity and altering the vascular tone. High sodium intake, as you know, sodium causes water retention. So, if the patient is consuming high salt, which leads to water retention, and thus this increases the blood volume, raising the blood pressure. Physical inactivity, lack of regular physical inactivity contributes to obesity, which further causes increased vascular resistance due to deposition of fat in the blood vessels, which leads to hypertension. Chronic stress, if the person is stressed for any reason, this causes sustained activation of sympathetic nervous system, which thus increases the blood pressure. And there are some medications and substances which contribute to increased blood pressure. The first of all is non-steroidal anti-inflammatory drugs. These causes sodium and water retention, which leads to increased blood pressure. Corticosteroids, given in so many medical conditions, example is prednisone, can lead to hypertension by promoting fluid retention. Oral contraceptive pills. Oral contraceptive pills are meant to be taken in emergency cases only, but sometimes patient takes it regularly. So it contains hormones that can raise blood pressure, which eventually causes hypertension. There are some stimulant chemicals and drugs also like cocaine, amphetamines, which causes increased blood pressure by stimulating the sympathetic nervous system of our body. So licorice products can cause hypertension due to a compound that mimic the action of aldosterone, which causes sodium and water retention. Other medical conditions are sleep apnea, obstructive sleep apnea where breathing repeatedly stops and starts during sleep, or snoring patients come with the complaint of intermittent oxygen deprivation, which leads to increased sympathetic nervous system activity and hypertension. Also, the sleep cycle and sleep pattern is disturbed. Pregnancy induced hypertension, this is a very common condition, but if it causes seizures, then it is known as eclampsia, and if only blood pressure is increased, then it is known as preeclampsia. Both conditions are characterized by high blood pressure during pregnancy, often due to abnormal placental function. Hypercalcemia, increased calcium level in the blood, often due to hyperparathyroidism, can lead to hypertension by affecting the contractility of blood vessels and kidney ability to filter the blood. So summary is hypertension can arise from a wide range of non-cardiogenic causes apart from cardiogenic causes, which includes renal, endocrine, vascular, lifestyle, medication related factors. Proper identification and management of these underlying causes are crucial for effective treatment of hypertension in cases where hypertension is secondary to another condition. Addressing the root cause is very much important and can significantly improve the blood pressure control. So, a physician can advise you so many blood tests to rule out the other causes of hypertension or to diagnose the root cause of hypertension. So, the first one is complete blood count to check for anemia. In case of anemia, the body requires more oxygen, and in anemia, due to less hemoglobin in the blood, it gets less oxygen. So, heart rate is increased or blood pressure is increased. Basal metabolic panel test, which includes serum electrolyte, which includes potassium, sodium, chloride, bicarbonate ions, blood urea nitrogen, creatinine, and glucose level. This panel helps to assess the kidney function and electrolyte imbalance. Like in case of increased sodium levels, hypertension is there. Liver function test to evaluate the liver health, which can be affected by various conditions, including alcohol use or other medications. Lipid profile to assess the cholesterol levels, as dyslipidemia is a common coexisting condition in patients with the hypertension. Renal function and related tests are there: serum creatinine, estimated glucose filtration rate to assess the kidney function, elevated creatinine and reduced eGFR can initiate chronic kidney disease, which we have seen further causes hypertension. Urine analysis to detect proteinuria, hematuria, or other abnormalities, which suggests renal disease, and we know renal disease causes hypertension. Renal ultrasound to visualize the kidneys and to assess the structural abnormalities such as polycystic kidney disease or renal artery stenosis, done through the Doppler. Renal Doppler ultrasound to assess the blood flow in the renal arteries. We know that decreased blood flow to the renal arteries causes fluid retention, which further causes hypertension. Endocrine investigations are serum aldosterone and renin levels. To screen for the primary aldosteronism, that is Conn syndrome, characterized by low renin and high aldosterone levels. 24-hour urinary aldosterone excretion to confirm a diagnosis of primary aldosteronism. As you know, increased aldosterone secretion causes hypertension. Cortisol levels measured via 24-hour urine free cortisol, late night salivary cortisol, or low dose dexamethasone suppression test to screen for the Cushing syndrome, because in Cushing syndrome cortisol secretion is more, which further causes hypertension. Plasma metanephrines and 24-hour urine catecholamines to screen for pheochromocytoma, a rare adrenal tumor that produces excessive catecholamines, which further causes hypertension. Thyroid function test, as you know, hyperthyroidism and hypothyroidism both causes hypertension. So in this we test for T3, T4 and TSH. Parathyroid hormone and serum calcium, as parathyroid hormone or parathormone is connected with the serum calcium levels, it increases the serum calcium concentration, which further leads to hypertension. Vascular studies, aortic imaging, CT or MRI angiography to rule out coarctation of aorta or any other vascular anomalies. Carotid Doppler or ultrasound to assess for the carotid artery stenosis, which can be associated with systemic vascular diseases. Sleep studies, polysomnography to diagnose obstructive sleep apnea, OSA, which is a common secondary cause of hypertension. This test monitors breathing pattern, oxygen levels, and other vital signs during the sleep. Other specialized tests are plasma urine and sodium and potassium levels to evaluate for mineralocorticoid disorders like hyperaldosteronism. Plasma free metanephrines as a more specific test for pheochromocytoma. ACTH stimulation test, adrenocorticotropic hormone stimulation test, to further assess adrenal gland function, particularly in suspected cases of adrenal insufficiency or Cushing syndrome case. Genetic testing, genetic tests in case of suspected hereditary condition like polycystic kidney disease or familial hyperaldosteronism, genetic testing may be indicated. Lifestyle and medication review, you have to ask about the alcohol consumption. And medication review, a physician has to ask about what medications the patient is taking which might contribute to hypertension. Example is NSAID, corticosteroids, oral contraceptives, etc. So this is the systematic approach investigating cardiogenic and non-cardiogenic causes of hypertension. It involves combination of laboratory tests, imaging studies, specialized investigations. These tests help to identify or rule out secondary causes of hypertension such as renal, endocrine, and vascular conditions. Early identification and appropriate management of these conditions can lead to better control of hypertension and prevents the complications further. Thank you.